Nothing really says self-care like a nice massage. But did you know that massage can actually be really great for your voice as well? So stress, it manifests itself in the form of muscular tension. This not only creates discomfort in our movement in everyday life, but it also makes singing much more effortful. Vocal massage isn't just limited to professional singers. It's beneficial to anyone who uses their voice a lot. So say your job requires you to talk for many hours a day, or you need to speak with a considerable amount of volume. It's not uncommon for people to feel their voices are fatigued, hoarse, and even painful at the end of a long day. Much like you experience headaches or a sore back as a result of stress and muscle tension, so too can you experience vocal symptoms. So let's take a look at some of the techniques that can get your voice feeling less like this and more like this. Hello, lovely ones. This is Livia. I'm a professional soprano, voice teacher, and the founder of Singing for Self-Care. If you like health and heart-based singing, I highly suggest you subscribe because I'm here for you on Monday with tips on your most powerful method of self-care, your voice. Because remember, you and your voice are practically magic. Through massage, we aim to release muscle tension and relieve vocal symptoms. It can also be useful to use static stretches after the massage for further release and relaxation. You may like to give yourself a vocal massage as part of your warm-up or use it as a restorative measure when you're winding down for the night. I personally like to use vocal massage as a cool down, especially if my practice session has been quite vigorous that day. So this is a bit how you would take time to cool down and stretch after you've had an intense workout at the gym. Our muscles and fascia share complex relationships where everything in the body is connected. A muscle group being overworked will likely cause an imbalance with a corresponding muscle group. So a part of your body that is tight could be having an effect on the ease in which you sing, even if that part of the body seems far away from your actual larynx. In fact, there is a very interesting relationship between tension around the pelvis and tension in the jaw. So things are far more connected than singers may think. And we also need to keep in mind that we use our whole body to sing, all the way from having our feet feeling nice and grounded on the floor to our core and pelvic floor muscles supporting the sound, and then making sure that we allow our diaphragm to efficiently descend and our lower ribs open. Like, it's not just what happens just here. We want our system of muscles to work in tandem as efficiently and healthily as possible, so we can vocalize as efficiently and healthily as possible. And that means making sure that we are balanced and some muscles aren't too tight or over engaged. When people complain of vocal strain, they're often referring to the uncomfortable feeling of a high larynx. So there are 26 muscles in the neck, and this network supports the larynx or voice box in place, much like a hammock. Now there's this bone called the hyoid bone, which is floating. It's not attached to any other bones. And from this bone, the larynx is suspended by some ligaments and a membrane. So this means that the position of the larynx is flexible. It's not fixed. There's no bones that have fused it into place. As a result, if the surrounding muscles of the larynx are tight, the entire larynx is pulled up into this high and tight position. Now, not only can this feel uncomfortable, but your voice also may sound shallow, forced, or tense. Now, this feeling of a high larynx is very common, especially if you've performed a long set of songs or your pieces have a high tessitura. High tessitura just means that the song on average sits quite high. So that's a different thing from range. A piece, for example, might have a really high note, but the tessitura, or where the melody generally sits, might be in a lower or more comfortable place. And alternatively, you might have something that sits generally high, a high tessitura, but it doesn't necessarily have a big high note. Anyway, what you may find can happen with high tessitura stuff is that you may feel your larynx getting higher and higher, and your throat feeling like it's getting tighter and tighter. Often a high larynx starts to happen more as an endurance thing. So through a long performance or a high tessitura song. You may not notice it at first, but the muscles surrounding the larynx may gradually be tightening over time. So this is why a good singing technique is important, as well as doing a nice cool down, such as the one we're going to be talking about today. Because typically we want the larynx to stay in a nice neutral or even slightly lowered position to achieve maximum resonance in singing. And this is only achievable when all of the muscles are nice and relaxed. It's common for accessory muscles to try and get involved when we are singing. So these muscles that are over-engaged are most commonly in our neck, our jaw, our face, and our tongue. Now, as mentioned, the muscles of the neck have a direct relationship with the position of the larynx, but other nearby muscle groups are also connected indirectly. So for example, if you have a tight jaw, it will tense some of the muscles in your neck, which in turn are going to affect your larynx. The jaw is made up of two main muscles, and both of them are very common places to hold tension. If you suffer from TMJ issues, tension headaches, or you grind your teeth at night, you likely know the effects of jaw tension all too well. So we have the masseter muscle. The masseter is the main muscle people often associate with the jaw. It is also the strongest muscle in the entire body based on weight. By the way, store that fact away in your noggin because it does come up in game shows and trivia nights a lot, that the masseter, most strong muscle in the human body based by weight. So anyway, this proved to be useful back in the days when we ate woolly mammoths. The muscle is significantly stronger than necessary for most things we do now in modern day life, especially singing, so it can very easily carry excess tension. If you want to find your masseter muscles, you can bring your fingers to the side of your face, just here, and bite down. And you'll feel a tight little bulge. So this is your masseter muscle. When we think vocal massage, the area around our temples and above our ears, that is our temporalis muscle, it may not immediately spring to mind given they aren't exactly in the closest proximity with our larynx. But this large area works in tandem with our often very overactive masseter. And this is also a really common place to hold tension, especially if you're prone to tension headaches, so it's important to release this. And I am just obsessed with massaging this place. It's just really, really, really good. The muscles of the neck are usually divided into three categories depending on their location. So we've got anterior, which is the front, lateral, the side, and posterior, which is the behind. And from here, they're usually further divided into groups from most superficial to deep. When we're giving ourselves a manual massage, we will likely find tension first in the superficial muscles because that's what our hands are making direct contact with. So in terms of large superficial muscles, we have the trapezius. So when someone says, "Can you please rub my neck and shoulders?" we automatically go to the trapezius muscle, these ones. So as well as being a virtually universal place to carry tension, you know, the whole weight of the world is on your shoulders, this large muscle group also has an impact on the larynx. Also important to note is the sternocleidomastoid muscles. So this is a set of thick muscles that are very easily visible and palpable through the skin. You can very easily find this muscle if you turn your head to the side. Just trying to see myself on viewfinder, hello. So you can see mine popping out here, goes from kind of the base of your ear down to your clavicle. Now, just because there's a lot of muscles in the neck that may not be as easy to specifically find, doesn't mean that they won't be released in a vocal massage. So keep in mind that the mass of the muscles in the neck is cradling the larynx like a hammock. So as we mobilize our larynx, does that freak you out? It looks weird watching other people do it, but we are going to do it together in a second. So there is going to be a nice little stretch of all these other small muscles as we do that. So let's get into the techniques of this circumlaryngeal massage. I'll also be posting a real-time follow-along video if you'd like to take some self-care time and join me for that whenever you want. Now, always make sure you start with gentle pressure and work your way up if you need to. If you find a spot that's a bit tighter or more sensitive, make sure you take your time and gently explore it and just, listen to your body. With bits that are a bit tender, you've uncovered some tension that you can relieve. And this is not only going to help you relax, but it will also help you achieve easier, healthy, and more efficient vocal function. But if for whatever reason you experience acute pain, make sure that you visit a healthcare professional. So you need to find a nice aligned posture before you start, feeling like your ears are directly over your shoulders, directly over your hips, or you might like to imagine that classic example of the string gently pulling your head to the ceiling, or you could think of a bobblehead as well, just nice and loose. So first we're going to start with our masseter. So we're going to push our fingers down on it somewhat firmly. Now, without moving your fingers, you're going to slowly open your jaw. And you should feel a nice little stretch here. Now, once you've held this for a few seconds, you can start to massage the muscle a little bit more until it feels nice and loose. We're now going to do the same thing for the temporalis now. So this is a bigger surface area, so you can choose to use your fingers like before, or you can choose to use your knuckles. So place a little bit of pressure there, kind of above your ears, and slowly open your jaw. Now you can give that a little bit of a massage too. I think circular motions feel really nice. If you carry tension in your face, this might be a nice time to give you a scalp massage, which is also very nice, or across your eyebrows like this. I really love to use my gua sha for this. So next up, we are going to work on the upper trapezius. So we're going to start with the outer edge. So you're going to put a little pressure with your fingers and just put it on the top of your trapezius. And slowly we're going to stretch our neck over to the opposite side. And then while we're here, once you feel that loosen a little bit, you can gently rock your head from side to side. And when you're done with that, you can just take your fingers up a little bit further up the muscle, push down, same thing. Ooh. Neck over one side for a stretch, and slowly rock the head backwards and forth. And you can do that up until you reach this juncture right here, until you get all the way to the top. So if you find a trigger point or not, or just somewhere that feels like especially tender, you can take a little bit of extra time to work this out slowly, and you will start to feel the knot kind of softening and melting under your fingertips. So we're going to move to the neck next. So right under the base of your head, where you find that bony area, the base of your head, you're going to feel a little fleshy area on the side of your spine. So we've got the bony bit, and then right underneath, on either side of the spine, just here. Now what you're going to do is you're going to use your fingers and you're going to do this motion. So you're going to be like opening up the tissue. Now what you can do if you want a little bit more of an intense stretch is while you do that, you can gently put your chin down, and we're just making the movement really nice and slow. And then when you finish that, you go down to the next vertebra. So you're not pushing on the vertebra itself, just on either side. And again, as you're slowly spreading the tissue, gently bring your chin down to your chest. And you're just going to repeat that every vertebrae down until you reach the base of your neck. Again, if you find a particular spot that feels really tender, take a little bit more extra time to just kind of work that spot a little bit more until you find it release. Now with your knuckles, or you could also use a gua sha here too, we're going to just start at the base of the ear and very, very slowly glide down the sides of the neck. Super slow. And just use as much pressure as comfortable. It doesn't have to be super, super strong pressure, because this is more of a myofascial release. And if you don't know what myofascia is, it's this kind of dense spiderweb-like tissue that covers the muscles, and it's something that keeps us stable. We want to keep this nice and flexible. So when you reach your clavicle or your collarbone, we're going to come up again and we're going to start the same motion, but this time just a little bit further back. So again, nice and slow. And for the third pass, we come to the back and same thing, a nice slow pass down the back of our neck. Next, we're going to move on to the sternocleidomastoid muscle. So again, starting from the base of the ear with your thumb and your forefinger, it's kind of like a gentle twisting motion like this. I don't know if you can you come closer to the viewfinder again? So we start up by the ear and gently twist like this. Now, if this is a little bit too intense, you can use your thumb and your forefinger to do little circles. And that feels really nice as well. Now, when you're doing this, as you work down the length of your neck, you may feel that the muscle starts to become a little bit more flexible, and it may feel like it's becoming unstuck from the muscles surrounding it. So when you get to this point, what you can do is you can gently grab the muscle and slowly take your opposite ear to your opposite elbow. It's pretty intense. And then move down a little bit further and gently stretch the opposite way. And you can do that until you reach the base where the clavicle is again. So again, you want to make sure that you're doing that for both sides. So hopefully by now you should be feeling a little bit looser and more relaxed. I know I am, even filming this video and massaging myself. So now we're going to get onto the fun bit, which is the larynx. So first we're going to find the top of our thyroid cartilage, which is like the protective house for your vocal folds. Now, if you were born male, you're going to have an easier time finding this because it's going to be the top of the most prominent part of your Adam's apple, and you'll feel it as this like tiny V-shaped notch. For people born female, you'll be able to find it if you lift your chin up and feel down your neck. So you'll feel there's kind of two prominent lumps. Now it's the first prominent lump, which is your thyroid cartilage. The second one's your cricoid cartilage. So first bump, you'll feel again that little notch. It feels like a little V. Now the other point we want to be familiar with is the hyoid bone. And now you can find this by making kind of a C shape with your hand. And you're going to palpate above the thyroid cartilage. So kind of below your jaw, you feel it's kind of squishy, 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 squishy. As you go down, you'll feel a hard bit. So this hard bit is the thyroid bone, and it's kind of in a horseshoe shape. You'll be able to feel it. So obviously you want to be really nice and gentle when you're feeling around here, because obviously this is a delicate area of your body. So keep relaxed and keep breathing. So gently with your fingers, you're going to find the space between your hyoid bone and the thyroid cartilage. In between this area, you're just going to really gently massage, super gentle, and just keep breathing. Now the gap between these two structures may feel very close together or even fused if you've been really tight here for a long time. So do only what is comfortable, listen to your body, because sometimes this can be a little intense. So next what we're going to do is use our fingers in a horseshoe shape to cradle where the hyoid bone is. And what we're going to do is we're going to gently swing it from side to side. Now it may feel a little bit sticky at first, but it will often loosen up a little bit and you'll get a bit more of a range of motion here. Gently we're going to hold onto the thyroid cartilage and we're going to be moving the larynx from side to side. Now if you hear some snapping or popping, don't freak out, it's totally natural and normal. Just keep relaxed and keep breathing. So as you enjoy a wider range of motion starting to happen, you can hold your larynx to one side and you can gently twist your head in the opposite direction. So if I move my larynx to the left, I'm going to gently look over to the right. And the other way. And once it feels really nice and loosey-goosey after this, I like to gently glide my larynx downwards in diagonal strokes. Or if you want to, you can just think of gently tugging it downwards. And it can help here if you want to think about yawning to kind of help feel the larynx settle into that lower position even more. So from here, any static stretches that you do on any of the muscles with massage are going to be extra effective. So I like to do the classic ear to shoulder or looking over the shoulder stretches. And I like to hold these for at least 30 seconds each. If you want to wrap up a few self-care practices into one session that not only is going to save you time, but is extra indulgent, complete your skincare regimen just beforehand and use the slip of your moisturizer for your massage. So as I mentioned, I also like to use my gua sha or my facial roller for more concentrated access to acupressure points. And I do this because I find it's just a little bit less work on my hands. Now, if you do use a gua sha for this, make sure that you are using unilateral movements. So you want to make sure that you angle the gua sha to move across your skin at least 45 degrees. You never want to do it directly at 90 degrees. So always kind of flush with the skin. And you want to make sure that both with the gua sha and the roller that you do it in one direction, not kind of backwards and forwards. And this massage is a wonderful segue into your stretching or yoga routine. So doing this massage followed by a whole body stretch is the perfect addition to a relaxing night routine to prepare you for a restorative sleep. If you do want to take a bit of time for yourself right now and do this massage with me in real time, you can click over to my follow along video where we will put this into practice. Thanks for hanging out with me and I will see you next Monday. Bye!